The dizziness appears abruptly. You're not expecting it at all, and then it's just there. And you can't look at anything because it's all spinning before your eyes. It's hard to walk forward. And when it happens often enough, you wonder what's wrong with you.
Dagmar Conradi suffers from sudden dizzy spells. They last for seconds, and that can be dangerous because she works as a surgical nurse in a hospital.
When I had the first dizzy spell, I was in the operating theater, and I just hoped I wouldn't fall over.
Dagmar went to her doctor, ear, nose, and throat specialist Volker Schuran. He suspected a positional vertigo, a functional disorder of the inner ear.
The inner ear's balance system includes the semicircular canals. Usually the posterior canal is affected. All three semicircular canals contain small crystals called otoliths. We suspect these otoliths have been dislodged from their usual positions and are in the wrong place, which can lead to vertigo attacks that can go so far as to trigger nausea and vomiting.
To be certain, Dagmar Conradi is given so-called Frenzel goggles, and the doctor changes her position several times. She shows typical symptoms.
We can look through the goggles to see if the eye begins to move involuntarily, if the eyeball dances. For us, that's a sign that dizziness can be caused by repositioning. And then it's generally a benign positional vertigo.
This kind of vertigo can be treated with special exercises. The patients themselves help move the dislodged crystals in their ears into other positions.
It wasn't a great feeling because it triggered the dizziness. I always had to hang on for a few minutes, a few seconds, to recover my balance again.
Dagmar Conradi did her exercises systematically for 2 weeks, several times a day. Her dizzy spells are now over, and she can cope with daily life again.